The Wall Street Journal is reporting this morning that a CDC advisory panel will delay a vote on recommending just who should get initial limited doses of any COVID-19 vaccine. This comes as 52,000 new cases of the virus were reported yesterday here in the US, and the death toll nears 200,000. Let's bring in Yahoo Finance's Anjalee Khemlani for more on this. Anjalee, just tell us the significance of this CDC panel delaying a vote on an initial vaccine rollout. What does that mean exactly?
Sure, Alexa. So what that means is that we're not going to get a clear picture, at least for the direction that the CDC already gave states earlier this month to start preparing for the distribution through the public health systems of any vaccine that is authorized. Now, what that really looks like is that we have so many different candidates in the race, and while there has been a lot of positive news, we saw already how AstraZeneca was delayed because of an unexplained illness in one of the patients. Similarly, other vaccine trials are facing sort of the same probabilities, but if all goes well and they do go ahead, they still have to understand the detailed results of those vaccine trials, which are now in phase 3 for Moderna and Pfizer, and to know who they are best suited for. So could they be best suited for older adults or younger or children, right? That data is not yet clear. And so knowing that information is important to then prioritize who in fact does get that. It's also important to note that whichever one does get authorized, if two do get authorized, it's important for individuals to get the very same vaccine as a booster shot. Both of these require 2 doses in order to be effective. So a lot of details go into this, and without the correct information, there's no real way for them to vote on it right now. That meeting does start at 10. I'm sure we're going to hear more details on that later.
And Anjalee, lots of focus, at least on Wall Street right now, on the prospects for a second wave of COVID-19. Is there anything you're seeing in the data that would prove that out?
Right now, we know that there are some states that are seeing spikes. So, for example, Utah, Idaho, as well as Wisconsin are seeing really interesting spikes right now. And other states where we've seen just reopenings or schools reopening, those have also seen spikes. So it just depends on where we're looking. But across Europe, we already know that a second wave has started. Some of the Eastern European states that had lifted restrictions early are especially susceptible. The UK already inputting some restrictions that could last about 6 months. So overall, as it comes as no surprise, we've heard from health experts from the very beginning that this is a possibility. But where those are coming right now still is on the lookout.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.